As more Americans lose massive amounts of weight through gastric bypass and other types of bariatric surgeries, the number of plastic surgeries that remove that excess skin left behind is also growing. But what about the patients who want different types of plastic surgeries who haven't lost their weight yet? Well, for them and for their surgeons, it gets trickier.
Obesity is an increased risk factor for any kind of surgery. And we have to balance that with patients. Oftentimes, patients who need breast reduction surgery, for example, may be heavier, and we have to really talk to them about weight loss and what surgery can obtain. At the same time, it increases the risk of the surgical procedure, and I think it's important to discuss that with the patient.
It's a balance between what your outcomes are going to be, what your expectations, what your health risks may be. If you've got somebody that's in the, a BMI that puts them into the super obese category, unless what you're doing is going to change their medical status or change the quality of their life or their health, then I think that those procedures are best put off until they've at least lost some weight and bring themselves down more into an overweight category.
We get blood work on them to make sure that their nutritional panel looks good, and then because their skin has been challenged and has been damaged by the excess weight over the years, they oftentimes have trouble with wound healing. And so we always counsel them about those things.
Patients who are heavier tend to be at greater risk for deep venous thrombosis or blood clots. They go up to their lungs. So we need to take every possible precaution for that, because sometimes that can even be lethal. They also have an increased risk for infection and maybe scarring that isn't so good.